Hi everyone, Dr. Peterson here with Regions EMS for today's COVID-19 update. Today is Wednesday, March 25th, 2020. As usual, the information that I'll be presenting is current as of today, may change from day to day or even hour to hour. Stay tuned to our website, regionsems.com, and our YouTube channel, Regions Hospital EMS, for up-to-date information. We will always post the date on our website when we last reviewed the information so that you can be sure that it's current and up-to-date. Couple things. One, I'd like to shout out to Kevin Lynch, our regular videographer, for developing some new graphics for us. I apologize for the quality in yesterday's video. It should be corrected today. It's a little bit different recording from home than it is in our usual studio, so we're trying to make this work. Also, I just want to mention that we're not yet in crisis mode. We are planning for crisis mode, but we are not there yet. Most agencies are experiencing lower than normal volumes, so we have not yet had to go to our complete contingency crisis mode plans, although there are many discussions that are occurring daily around that. So just keep that in mind. We should still be providing the usual expected standard of care for our patients. If there are any changes made to any patient care guidelines or protocols, those need to be approved by our medical direction team before they are implemented. So make sure that if your agency is looking at some alternative triage, treatment, transport protocols, that we need to be involved in those discussions before they go live. As usual, information is posted on our website, regionsems.com, a summary of this video, as well as some additional documents that might be useful will be there. We are also creating a frequently asked questions section, so if you have any questions, please reference our website, but also feel free to contact us directly. regionsems@healthpartners.com is a good email address to use. So again, a summary of our recommendations current to date. First of all, protect yourself. We need to limit the number of providers involved in patient care. Most situations may only need one provider involved. Use some good judgment, but limit the number of people that are in close contact with the patient whenever we can. Ask the patient to meet you at the door, or ask staff at the facility to bring the patient to the front door so that whenever possible, you don't need to enter the house or the facility. In many cases, I think we can avoid this if the staff or the patient is willing to meet us at the front door. No nebulizers in the ambulance. Been harping on this. It just generates a lot of aerosol particles in an enclosed space. If the patient absolutely needs a neb, it should be done outside the ambulance. Keep in mind that for asthma, epinephrine is an acceptable treatment option, so make sure you review your patient care guidelines so that you have all of the tools available to you. Also, we are recommending the use of inline viral respiratory filters with all neb kits, as well as with all BVMs and airway device uses. These small, cheap filters fairly effectively can filter out viral particles. You can attach it to the exhaust port of a T-piece on a neb treatment, or in line with your BVM or airway device setup. We are procuring some through Regions EMS, so if your agency is not able to procure them on your own, please contact us, reach out to us, and we will do what we can to assist you. Let's try to maintain at least 6 feet of separation from our patients whenever possible. Obviously, there are times we need to perform a hands-on exam or do a procedure, but whenever we can, let's take a step back and just add a little bit of distance between us and the patient. If you're a first responder, we would encourage that you perform your initial assessment and scene size up either through a window or from a doorway. You may not need to enter the facility or the house if the patient appears stable, awake, and in no respiratory distress or other imminent life threats. It's perfectly fine to stage outside and wait for EMS if you can do that initial assessment remotely. If the patient does require transport, but is not likely to require any procedures or close monitoring or deterioration, with the current suspension of EMS statutes in the state of Minnesota, it's perfectly appropriate and acceptable to transport the patient alone in the back of the ambulance without a provider present. Obviously, again, use good judgment and common sense, but that allows you to minimize the time that you are in close proximity to a patient, especially in a confined enclosed space like the back of an ambulance. We also need to protect others whenever we can. Several things that we can do. First is no riders in the back of the ambulance unless the patient absolutely needs a guardian or a support person present. Hospitals are restricting visitors. In many cases, no visitors at all are allowed. So even if you bring someone with in the ambulance, that doesn't mean they will be allowed into the ED. They need to find their own way to get to the hospital and make their own arrangements whenever possible. We also, as EMS providers, healthcare workers, need to practice social distancing. We are obviously exposed to these possibly infectious diseases on a regular basis due to the nature of our jobs. So we need to keep our space, our distance from our coworkers, so that we don't infect them and that they don't infect us. Specifically, I'm talking about congregating in the ambulance entrance at a hospital. I know it's a time when you sometimes see other crews, other friends, but we need to maintain our social distance as much as we can. We don't want to spread anything any more than it already is. And obviously, regular hand washing and that kind of thing goes along with that. Be mindful of where you're doffing, disposing, and disinfecting of your PPE equipment so that you're not trying to clean something right next to a pathway where another crew is bringing in a non-infected patient. Most hospitals are likely going to implement some traffic flow pattern changes, so you'll be leaving through a separate door than you came in. But just be mindful of that when you're using PPE, where you're removing it and taking care of your equipment. Let's see here. Cardiac arrests. We should be limiting transport of cardiac arrests whenever we can. Most PEAs and asystoles do not need to be transported. Keep in mind that if the hospital can offer something that you cannot, which in most cases is going to be ECMO is the one thing that comes to mind, but most of the non-shockable rhythms, there's really nothing that the hospital can do above and beyond what you've done. So let's limit the exposure, especially with bag valve masking and some of the body fluid that might be encountered in a cardiac arrest situation. We really need to work those patients on scene and not transport unless there's a good reason to transport those patients. PCR signatures. I would encourage you to avoid collecting signatures for now. Patient signatures, staff at the ED signatures. We can limit the number of people touching your tablet, touching your stylus. Those signatures just aren't a critical part of patient care. They are an important part of documentation, but we can get around that now by documenting unable to sign due to the current pandemic. And as long as you document clearly in your narrative the steps you took, warnings, recommendations, liability things that you talked to the patient about and that you transferred care appropriately to an ED staff person, your narrative will be proof of that rather than the signatures for the current time being. Also be aware that many hospitals are beginning to screen everyone who arrives for fever. This includes EMS, law enforcement, and anyone else when you're entering an ED. So you may be held up briefly to get a quick temperature screening. I think this is an important step that the hospitals have taken as we have identified a few people who have become symptomatic during their shift, who were not symptomatic when they began their shift. So it might come as a surprise, but you need to do the right thing here and go ahead and let the hospital do their screening to protect their patients. We need to conserve our PPE. I've been emphasizing this over and over and over. We have plenty of PPE right now in most situations, but I suspect we will run out as this surge really picks up in the next few weeks. If your department allows, conserve the N95 masks unless you are performing an aerosol generating procedure. For most patients, a simple face mask is adequate, but it's also still a good idea to maintain some good distance between you and the patient. But let's save those N95s for when they're absolutely necessary. There is some discussion right now about when they can be reused. Some of that will come from your agency, your leadership. From our perspective, as long as an N95 mask is not visibly soiled or contaminated, it is appropriate to reuse that as you're protecting yourself, especially as we run short on these supplies. We need to consider, or at least start thinking about protecting our EMS resources. As we move into the contingency and crisis mode of care in the next few weeks, we need to think about encouraging our patients to find other ways to get to the hospital. We can encourage non-transports or alternative transports for patients who appear stable and really are only looking for COVID-19 evaluation. You can contact medical control through MRCC to assist in these discussions with the patient and assist in making these decisions. But as we move into a point where our resources are stretched, we need to start thinking about selectively transporting patients who really need to go by ambulance to the hospital versus patients who can find another way to get to the hospital if they need to go to the hospital. We also need to protect the airwaves, radio waves, cell phone networks. Let's use radios as much as we can to avoid overloading the cell phone networks. We've already seen some issues with that. And currently we are requesting that you do not call in non-transport reports to MRCC for low-risk patients. Let's just get that off the table right now so that as the volumes start to ramp up, we're not tying up the airwaves with those low-risk non-transport reports. Testing supplies are still limited, although we are anticipating that they will loosen up a little bit in the coming days and weeks. We are still only testing a very small subset of patients in the ER. Most patients who come to the ER concerned about COVID-19 will not get tested. We will assume they have it and we will give them appropriate recommendations, but we are not testing everybody who comes to the ER. As first responders, EMS healthcare workers, if you become symptomatic, we may be able to test you. We have a document on our website that gives you a nurse triage line that you can call for further information and to set up the testing, or you can contact your agency's occupational medicine clinic if you have an agreement with somebody for that. But like I said, we are testing healthcare workers who are becoming symptomatic so that we can understand the quarantine durations and how it's going to affect our workforce. If you think you've been exposed, there's not necessarily a reason to isolate or self-quarantine. If you wore appropriate PPE throughout a patient care encounter, you do not need to isolate, quarantine, or leave work early. If you become symptomatic, that's where things change. Or if you had a high-risk exposure to someone, then we would want you to call the nurse line as well. High risk meaning you were not wearing appropriate PPE, or you were performing an aerosol-generating procedure for a prolonged period of time, or something happened with your PPE, and you have concerns that maybe that you were exposed to something beyond just through the mask. Again, the document is available on our website, and this is one of those recommendations that likely will be fluid and will be changing in the coming days and weeks. Finally, other resources, again, stay tuned to our website for up-to-date information. We will always keep the date current so you know when we last reviewed our recommendations to make sure that what we're giving you is up-to-date information. A good email address if you have questions is regionsems@healthpartners.com. We are also posting a list of frequently asked questions on our website, so feel free to check that out as well. And then finally, again, this is unprecedented. Our world is upside down. Our lives are completely different. We don't know what's going to happen. Some of us don't even know what day it is from day to day. Just take care of yourselves. Find a way to relieve your stress when you get home. Protect yourself, protect your families, protect your colleagues. Stick together, appropriately distanced, of course, but let's stick together on this and we will get through this. So stay safe and thanks for watching.